Hello, my name is Dr.博邦I am an infertility specialist at Genia IVF. Today I would like to talking about the problem in the modern society. Some women face a problem about to having a baby because nowadays you know that the environment and the lifestyle had changed a lot from in the past. And right now I think many of you may have some question in your mind about your infertility and how to correct it. So let's see about a common question and let's discuss about what we can do for that problem. For some couples that have been trying to get pregnant but not succeed yet, actually the cause of this problem can come from both male or female partner. But when we focus on the female partner, the most important and most common one is about the ovulation. If you have not regular ovulation, it will be difficult to date the day for intercourse. The other problem can come from the other part of the reproductive organ, for example the tube, the womb itself. If you have the tumor, if you have some scar inside, it may make the structure in an abnormal position. So even you have ovulation, the eggs cannot get into the tube. So even you have the sexual intercourse on that day, the sperm cannot fertilize with the egg. That will be another problem. For some specific problems such as endometriosis, and you may want to know what is this problem. The endometriosis is the problem that your endometrial lining grows outside the womb. So it means that when you have period, in general the endometrial tissue will shed out and become the menstrual blood. But when it grows outside the womb, it means that it have no way to go out. Sometimes it's collect together and become the cyst. You may have heard something about the chocolate cyst. That's another kind of the endometriosis. When we're talking about the endometriosis that we see in a kind of cyst or the chocolate cyst, actually this kind of cyst can have the problem about the infertility. By the cyst itself can make the quality of the eggs inside becomes like poor quality eggs, and also the cyst itself can make the ovulation problem also. So sometimes we're talking about the cyst that we have to consider if we should remove the cyst out before the infertility treatment or after the infertility treatment. Because if we do the cyst surgery, it means that you have to remove the cyst by the way that to remove all of the cysts and maybe include the normal tissue outside together. Then and after surgery you may have poorer level of ovarian function. And when you consider about the treatment of infertility after remove the cyst, it may make it more difficult because when the level of ovarian function becomes lower, it means that it will be more difficult to produce the eggs from your ovary. So when we're talking about the endometriosis, it depends on the type of the endometriosis, and the treatment will be depends on the condition of the endometriosis again. The other type of endometriosis can make the scar inside the womb or outside the womb or at the tube. Overall, this kind of scar can make the anatomy of the womb become distortion. This means that when you have ovulation, it will be more difficult for the eggs to get inside the womb or inside the tube for the fertilization. So sometimes if the patient comes with endometriosis without the cyst but have the scar formation, the kind of surgery will be to remove that scar and to re-correct the position of the wombs again. So when we're talking about the endometriosis, I suggest you to see the doctor to check the detail of the disease again and choose the right method of the treatment for you to preserve your fertility and to improve your fertility in the future. Sometimes irregular period may come from the other medical conditions that may be related to the hormones or related to the function of ovulation. For example, the women who have hypofunction of the thyroid or the poor function of thyroid, or sometimes the women have the other hormones abnormality. In that cases, I suggest to check and to see what is the cause of that abnormal hormones, and we can treat that by the medication. And after that, this kind of woman can come back to ovulation like normal, and she can conceive easily. And also, if they have this problem for at least 1 year after complete of the treatment of the medical condition already, it means that she may have something more complicated for the fertility treatment and maybe necessary for her, that one may come back to do and consider to do the IUI or IVF, depends on her condition again. Sometimes the irregular period may be from the poor ovarian function. It means that your ovary cannot produce the eggs as in the normal way. Sometimes the eggs cannot grow well. Sometimes inside the ovary have not enough eggs to grow. It means that you have to check the level of ovarian function. No matter how old you are, sometimes it happens in a younger woman also. That's very important. If you feel irregular period or experience irregular period for a while, I suggest you to see the doctor to check for this problem also. Because if you have the poor ovarian functions, it means that your timing to have the baby have come to the small limit already, or it's have limit chance to have the baby by yourself by the natural way. It's maybe time that you have to consider to do even IUI or IVF, especially if your ovarian function is very low. It means that the IVF may be another better option than you trying by yourself. I always see many patients come and ask about if I'm too old to have a baby. I think that we have to mention about age and fertility. In general, when you're getting older, it will be more difficult to have a baby. The older woman will have less chance of have good quality of the eggs, and also you have less number of the eggs, but the chromosome inside have a higher chance to be abnormal. It means that when you're getting older, you have less number but poorer quality and have a higher chance of abnormal eggs together. I would like to let you know about the infertility or fertility awareness, because sometimes when you're talking about the fertility to having a baby when you are 20 years old, you may think that it's too soon to talking about that. But actually, right now, we know that not only the older woman will have this problem. Sometimes in the younger woman, it still have the problem about the ovarian function also. So I don't want you to wait until you're older than 35, 38 or 40. I would like you to aware of the problem about your age, about your ovarian function together. You should go to see the doctor to check the ovarian function and to discuss about how the age impact on your chance of having a baby at this moment. And you may plan for the egg freezing or plan to have a baby sooner than you have planned at first. The first thing that you have to come here and we will do is we have to talk together. I have to ask about your history, about your problem in your family, because the fertility treatment is also concerned about the genetic disease that we need to check if you have any problem or not about that. And also I will ask about your health problem, your underlying medical conditions, and your previous menstrual history or the previous pregnancy history in the past. So I can use all of the information to see what is your problem at this moment. And in general, for the lab checkup, I will start from the ultrasound. The ultrasound can help me to get some information about your reproductive organ. So we can see how the womb is, do you have any cyst or tumor, how the ovary at this moment, and sometimes we can check if you have ovulation normally or if you have any problem that we need to correct before the fertility treatment. The second one that we check is about the blood test. For the blood test, we will check for the general health. We will check that if you have any problem that may be affect on your future baby. The complete blood count to check your general health status, and also we check for the hormones to make sure that your hormones is in the normal level. We check the infectious test, because you know that when you have some infection, it may be passed from you to the baby also. So we have to check that to make sure that the baby will be born safely. Thyroid functions, the diabetes problem, because this one is also associated with the chance of pregnancy, and also when you get pregnant, it will affect on the chance that you have a miscarriage or something in the future. So we have to check that out. All of these tests can be done just only in the single but taking sample, and also the ultrasound can be done just only in a few minutes. So you may have complete the checkup just only in 1 or 2 hours. I would like to say that it's not so difficult. You can come to the clinic on any day of the menstruation, but if you want to come and to start the treatment in the same visit, I suggest you to come on day 2 of the period, because that time will be the best timing for the evaluation. The most important thing that I want you to aware about your ovarian function, aware about your fertility level. I want you to check your problem as early as possible, because even you have a problem about the ovarian function, but if you try to correct it at the time that you are still young, it still have more possibility that you will get pregnant. But if you come here at the time that you are getting older, like more than 40 years old, the problem will be more difficult. I have so many cases come with this problem. Even we can try to help them, and many cases that older than 38 still possible to get pregnant. I would like you to aware about your fertility and concerned about the future of having a baby. I would like you to come to Genia. Our team can help you to check your fertility and to give information for you and prepare for your future baby.